Hello and welcome to the Health Wizard podcast. I'm your host, Yelena Isolde Medici, a health and life coach. I'm so excited that you're choosing to listen to my podcast because you are choosing to make your health your priority. The Health Wizard podcast is dedicated to teaching natural, easy to implement practices that you can use to get your health on track and become the person you used to be before getting sick and the person you're dreaming of becoming again, happy, healthy, full of energy, and living a life filled with joy. Now, very quickly, before we dive into the good stuff, I want to remind you that this podcast is intended for education and entertainment purposes only. This podcast is not a substitute for professional medical advice. If you have a medical condition, please seek the help of a licensed medical professional. I am not a medical doctor. I do not treat, diagnose, prescribe, or make claims outside of my areas of expertise. So by choosing to listen to the Health Wizard podcast, you take full responsibility for your own actions. And when you hear the testimonials of the people who were able to get well, realize that their outcomes depended on their effort and their specific situation. With that said, let's jump into today's episode. Please enjoy. Hello, beautiful people. This is Yelena, and welcome to this episode of the Health Wizard podcast. Today, I wanted to come into your airwaves with a simple message of hope and encouragement. I know that our country right now is going through tough times. A lot of you have lost your livelihood, maybe your homes, your businesses, or simply your sanity because it seems like the world from the outside is closing in. And if you are struggling with health issues such as Hashimoto's, Graves' disease, hyperthyroidism, hypothyroidism, thyroid eye disease, endometriosis, PCOS, infertility, or any other hormone or non-hormone related issue, you're probably facing some of your worst fears because the big question is, if something happens or is happening to my immune system, how can I possibly withstand possible threat of COVID or the flu or the cold season? And the fear is exponential because you feel like maybe you don't have everything that you need to keep up with the life you used to have. And even worse than that, you are now facing with fears where you realize that everything that you were using in order to get better and be better, such as supplements and medications, can be taken away at any time. I just received a report from a couple of my new clients that their doctors just told them that their medication was recalled. Medication that was supposed to be saving their lives that they were on for a month or longer, all of a sudden was declared to be subpar. The quality is not great enough and they're recalling it. And these people were depending on their medication to keep their numbers on track, to keep their well-being on track. And what they found is kind of like a house of cards. If one of them is taken off, the rest falls. It has always been my goal for myself and now for my clients, since I've been coaching for over the last decade, to create a way that would afford us the ability to create the kind of health that is not dependent on external circumstances. Yes, to a great diet. Yes, to a great mindset. Yes, to finding out the root cause of the problem and uprooting it, but no to these external circumstances that might be taken away from us within a moment's notice or be in some way ineffective. Now, I know that if you're listening to this podcast, you probably had already tried many ways to get better. Supplements, medication, therapists, osteopaths, naturopaths. And I'm just mentioning things that I tried for myself when I had battled hypothyroidism. And I do feel kind of like a warrior because it was an everyday, nonstop effort, doing more research and trying out new things, seeing new doctors, trying out new supplements, new medications. So I felt like a warrior and it felt like a losing battle. And when I was going through that, here's what I decided when everything was said and done after years of trying things that left me wanting, was I wanted to be minimalistic in my health effort, but to get maximum outcomes. I asked myself, if I had my life in a most perfect, desirable way, how would I build it? How would I have it? If I were to create a kind of health that never fails me, save possible external circumstances like accidents, then what would I want it to look like? And I made a decision for myself that I want my health to look like this. I wake up in the morning. I have my water. I take my shower. I open the fridge. I open my pantry and I have a meal. And then I go about my day. I didn't want my life to continue to look like this. You wake up in the middle of the night to take medication. Then you go back to sleep. You hope that you fall asleep. Then you wake up and you take another medication or a supplement. You have some with meals, some before meals, some after meal. Then you wait maybe a couple of hours or another hour, and you take more medication and you take more supplements, only to find out that you're struggling even more, although your numbers are looking great. And now that you're also having more symptoms and side effects from said medications and supplements. That was not the kind of life that I wanted. And I did everything that was in my power to pave a way for myself and for whoever came after me to achieve the kind of life that affords me 100% health as much as humanly possible with a minimalistic approach. And this is what I know, that this kind of life is not only possible, it is absolutely probable. I created this kind of life and health for myself. I've worked with thousands of women and men from around the globe, 30 countries and counting so far. They have been able to achieve the same, and there's absolutely no reason for most people to be able to do the same thing now. There is a time and a place where medication have a place in our life. If I were in an acute situation right now, if I needed my leg operated on, I would take drugs. In an acute situation when we're in a need of saving a life, we should consider everything that's available and possible. In chronic conditions, however, such as when we have thyroid or hormone conditions, we want to take a different approach. Not patch it up and keep me alive on life support if possible, but more of find out where the problem lies. Find out what's creating it. Resolve it. Give me minimalistic tools so that I can replicate this effort and this outcomes for the rest of my life. I personally now have exactly the life that I dreamt about. I wake up in the morning, I take my shower, we have a breakfast, and I go on about my life. I take only one supplement when I need to, and that one is specific to me. For everything else, I eat, I move, I get out in the sun, I manage my stress, I manage my expectations, I manage my lifestyle, I address my trauma, I address my stress, and I live this balanced life where I can replicate what I created over a decade for myself over and over and over again. So to this day, I'm still symptom free. To this day, I still don't have to worry about, oh my goodness, what if there is a pandemic and there is no medication? What if they shut down hospitals and doctors cannot take my call? What happens then? I can now sustainably maintain my health unless there is a freak accident. And this is what medicine is supposed to be for acute situations, for situations when we need to save our life right now in the moment, in a critical situation, but not when it's a chronic condition. For chronic conditions, modern medicine is and had failed us for a long, long time now. It's become like a circus. You go see a doctor, the doctors run your labs. They get your labs and they're saying things are looking bad. Get in medicine. You get in medicine and maybe for a short time you get better. But then normally you don't, because most medication needs to be adjusted every month and a half to about 2 months. And so you come back to the doctor because now you have your symptoms and side effects from medication, and they run your labs again and they say, well, let's up your medication or let's cut down your medication. And you go through this cycle over and over again until one day, hopefully you wake up and say, listen, Einstein said it, that doing the same thing over and over again and expecting different outcomes is the very definition of insanity. What am I doing to myself? And when you have that wake up moment, this is the moment when the universe opens its doors and says there are things outside of the small box that you were placed in that can give you your health back. And these things, they're here for you. There is a way to distress your body because stress is a killer. And not only through heart attacks and strokes, it's also a killer through your hormones. There's a way to take care of your past trauma to address depression and anxiety and panic attacks. There is a way for you to address your antibodies, maybe through addressing your genetic mutation or there's a deficiency. There is a way to clean out maybe a dental infection in your mouth so that your body can start operating better. There is a way, but we can never have that way available to us until we finally get to a point of saying, I need my life in a specific way and I want it my way. And usually here's what we want. We want simplicity. We want sustainability. We want longevity. And without this approach, no tools that you try out there are really going to work. I work with a lot of women who want to lose weight. That's a commendable desire. If we have excess weight, we should lose it. But I approach it differently. I'm not one who says, let's lose weight no matter what, because normally there are reasons why we gain weight and why we keep it. It can be the diet, it can be stress, it can be genetic mutations, it can be thyroid related, it can be hormone related, so many issues. But we don't just say, let's just diet, let's do a cleanse, you're going to lose weight and everything is going to be great. It doesn't work that way. The weight loss industry is over $1 billion industry right now in America alone. People try these magic bullets, actual medicine. They try supplements, they try counting calories, Weight Watchers, and so on, in hopes of losing weight. But because they don't address the root cause of their weight gain, their outcomes are short-lived. They're not sustainable. I have seen people lose weight through calorie counting, keto diet, which is really horrible for you, paleo diet, again, another horrible diet. And if you want to train in on that, shoot me an email to info@360impactcoaching.com. We'll send you training on that. And listen, if you want to lose weight, there are many ways to do it. One of them, you can do chemotherapy. You will lose weight, but it doesn't mean it's a good, sustainable way. What we're looking for is sustainability, as close to natural as possible, and it all should be natural. And it should be simple and it should be easy. It should not drive you nor your loved ones crazy for you to get healthy. So for me, when I sit down and I looked at my life, I said, listen, whether it's the case of crisis or my everyday life, when I want a minimalistic approach and I want simplicity, things should be easy and they should be sustainable no matter what happens. I should not be afraid of having to pack a suitcase full of supplements and medication every time I travel. I want to put my clothes in, get my family, get on the plane, and get going. And that's exactly the life I created for myself. Now, here's a big lesson and hopefully an aha moment for you that I want to leave you with today. That we get in our lives everything that we are willing to settle for. If you are willing to have doctors, and now mind you, there are some good doctors, so I'm not talking about all of them. But if you're going to allow, and if you don't mind it, allowing doctors to mistreat you, that's exactly what they're going to do. They're going to tell you, cut out or radiate your thyroid, remove your breasts, remove your ovaries, remove your fallopian tube, your uterus. Piece by piece, you will be taken apart. And here's what I found that's interesting though. If a man ever struggled with his health issues and he went to the doctor, doctors normally don't recommend the same things to men as they do to women. To us, they feel like we are expendable and disposable. Cut out this, radiate that. With men, they're usually going to take a different approach. Now, that's a conversation for another time. But what we see, what I see in my practices and what you will see in your life is if you allow doctors to have their way with you, they're going to give you the best of what they know, and mostly it's going to be medication and surgeries. Or when everything else fails, they're going to tell you it's in your head and you need to go see a psychiatrist. Everything that we get in life is a reflection of our internal world. If we're going to allow people to mistreat us, they will mistreat us. The moment, however, that we look inside and we say, I'm worthy of health, I'm worthy of natural health, I'm worthy of sustainable health, and I will not settle for anything else less than that, then you're not going to allow any butcher or doctor to take you apart piece by piece. And you're going to look for professionals who can give you exactly what you desire. And if you desire health, if you desire it naturally and you desire it sustainably, then one way or another, whether you call it God, universe, or some magical force, the universe will provide it for you. Sometimes it's not overnight. Sometimes you have to go looking for it. This is how my clients find me. They go Google it. They find either this podcast or YouTube video or a Facebook post or my website. One way or another, we end up meeting. But none of them would ever find me if they just sat around and accepted what the modern medicine has to give them. Again, there is a time and a place for modern medicine. When my husband needed a brain surgery, I loved having an educated, trained doctor. That's not what we're talking about today. We're talking about chronic conditions. But the only reason that we have this amazing outcomes with my clients, and if you've never heard a story from one of our clients, go to our website, It is www.360impacthealth.com. You're going to click on client success stories and you're going to see them. Time after time, story after story, these women got everything that they were hoping for and were willing to put their effort and their resources into. And that means this: near 100 or 100% health that is sustainable, that is natural, and that will last them a lifetime. If you've been working with a doctor for 6, 7, 20 years and you still need to go back to the doctor is not doing his or her job. It's not just a medical doctor, a naturopath, or any other specialist. My job, normally my calling in my life, is to give my clients everything that they will need in order to get healthy and stay healthy within 3 to 12 months. Normally after that, nobody will need me again, because they have all the tools that they will need to keep themselves sustainably healthy for as long as they live. Now, are there exceptions to these cases? Of course, as with everything in this universe. However, I have a very robust process where I basically audition my clients. I have them apply for a call. We have a couple of calls. When we look and qualify, can we help them? Can I get them from where they are now to where they want to be? And when we look through all of the factors, if I feel that we can get them there, only then do we say yes. We don't say yes and then try to figure it out. That's why we have such an amazing success rate at over 95% with our clients right now. But the lesson to glean from this podcast is this: in order for you to get the kind of health that you want, you first have to say no to the health and the treatment that you don't want. Now, I'm not inviting you to go off medication, to quit your doctors. I'm inviting you to do things that are logical in a way that common sense would say that if we got ourselves sick, we should have a way to get ourselves healthy again. And if there's not a way that a specific profession that we rely on can show it to us, then we'll look elsewhere. A lot of my clients come to me and they're on medication. And then as I work with them, and we give them the support and guidance, and they find out and start addressing the root cause of their health issues, then when the time is right, we always start a conversation with them and their doctors. Over 80% of our clients are able to go off medication. But they don't just go off of it. You cannot and should not do it without medical support and without foundational support from your diet and lifestyle. The story here that I want to stay with you is that internally, if you're going to say yes to health, and say, yes, I deserve it the way I want it, and the way I deserve it, then you're going to find a way to get it. And if you settle for anything, then you're just going to get anything. And that often means, unfortunately, my dear friend, that you will suffer unnecessarily at the hand of people who are supposed to be helping you. So today, if you're finally in a place where you're saying enough is enough, I've tried doctors, I've tried naturopaths, osteopaths, I've tried supplements and medications, I've tried therapies, and I've tried everything but the voodoo magic, and I'm just not getting where I need to be, and I'm ready for more. I want to invite you today to reach out. I'm going to leave a link for you to be able to schedule a call with us in the description of this podcast, or you can go to www.360impacthealth.com/schedule. And you can grab a 15-minute spot with me and my team. We're going to ask you 10 questions in order to see if we can help you. And then if we can, we're going to move you forward to have an hour-long conversation with us to talk about the how portion. And this is when we know what is possible, what's doable. And my approach is very simple. We get all the data from you that we can get. It's not just the medical data. It's how are you feeling? When did problems begin? What triggered them? And we'll look for the root cause. So that's the second step, identifying the root cause of your health issues. And we'll look at about 20 different factors. And then only at that point do we say, okay, this is how you should eat. This is how you should handle your stress, your relationships. This is how you resolve trauma. This is how you address X, Y, and Z. And then we equip you with all the tools that you'll need for the rest of your life to not only get healthy, but to stay healthy. If this sounds like what you want for yourself, then it's very simple. Go to www.360impacthealth.com/schedule, and you're going to be able to start this journey with us. Now, if you're not ready for that leap yet, if you want more information, if you want more of building the trust between you and I, it's very simple. Go to my website, 360impacthealth.com. Look through all the bonus free information that I have on the website, the articles, the podcasts. Look at the success stories, look at the interviews, and make a decision for yourself on what it is that you are not willing to settle for and what it is that you're determined to have in your life no matter what. And here's what I've learned from my years of practice and me being healthy myself now for over a decade, is that the journey to the finish line, as the Chinese proverbs goes, that the journey of 1,000 miles starts with a single step. Sometimes it's that small decision that we have to take and make is, I am not willing to settle for anything less than 100%. After that, the next decision and the next decision and the next decision, until one day you find yourself, hopefully in our client hall of fame, where you're absolutely symptom-free. Or maybe you work with somebody else who helps you achieve similar outcomes. Now, I know that we're the best in the business only because we are the best in the business, and I've gone through these health issues myself, similar to yours. And I've been through the mill of brokenness between doctors and naturopaths, osteopaths. I work with a chemist, spend tens of thousands of dollars and still not better. I walk the walk. Myself and the coaches who work for me, they've all been through my program and they've all gotten themselves well. So we know what we can do, but whoever it is that you choose them with the rest of your life in your mind. Trust should be there. Common sense should be there. Proof of concept should be there. The certainty that you can get to an outcome should be there. And if it's not there, whether it's us or anybody else, run. Run to whoever can get you there. So today's lesson is, I know it seems like it's bleak and hard out there right now, but in the midst of any crisis, there's always a benefit to be discovered. There's always the silver lining, whether you can see it or not. So if anything, I hope that I have left you with a message of hope today. So you can say, yes, it's possible for me. I deserve it. I will find a way to get to it. I want to wish you all a fantastic rest of the day. Is nothing but optimal health. Next time when I come into your airways, look out for an interview with Michael Stone, the creator of Breathwork. I'm going to tell you exactly what it is, how it added to my health kit, and how it can be beneficial on your health journey as well. Also, if you have not yet joined our online support community for women and men who are struggling and wanting to resolve hormone and thyroid conditions, make sure to click on the link in the description of this podcast and join it today. It's absolutely free of charge, and we are there to support you and get you started on your path to optimal health. This is Yelena signing off and wishing you the best and the most wonderful that life has to offer. There you have it. I hope you enjoyed today's topic. If you did, make sure to subscribe to the Health Wizard podcast, and please don't forget to tell others about it. If you would like to get more information about me and what I do, how I help amazing human beings just like you to achieve their dream health, go to www.360impacthealth.com. Go to the contact page and shoot me a note. Thank you so much for listening. I'll catch you on the next episode of the Health Wizard podcast. This is your host, Yelena, wishing you optimal natural health.